Commentary data from Partners Healthcare shows that about 1% of asymptomatic patients at Partners hospitals tested positive for the coronavirus. Dr. John Iafrate, a pathologist at Massachusetts General Hospital, takes a blood sample from a Chelsea resident at a pop-up testing facility in Bellingham Square. Jesse Costa, WBUR, asymptomatic coronavirus cases have been making headlines recently, causing much confusion and controversy. The very topic is inherently frightening. If someone can spread this nasty virus without feeling sick, how can we be sure our socializing is safe? There's still a lot we don't know about asymptomatic cases, and anyone who pretends otherwise is making stuff up, unfortunately a common occurrence these days, when COVID-19 experts have proliferated like the pollen count in spring. But with that caveat taken care of, let's go ahead and pose some frequently asked questions and do our best to answer them. What does asymptomatic COVID-19 even mean? Chills, fatigue, headache, loss of smell, cough, shortness of breath, all are symptoms. And all of these are pretty common in people with COVID-19, which is why I listed them. We shouldn't confuse symptoms with signs, things clinicians detect on a physical exam, or abnormal lab tests or imaging. Anemia, low red blood cell count, is not a symptom, and neither is pneumonia, infection in the lungs. So, symptomatic COVID-19 means a person has reported a problem linked to this illness. In medicine, we sometimes call them complaints. Throw the prefix a, meaning without, in front of the word symptomatic, and you get asymptomatic. A person with no complaints, no problems. They feel healthy. Some argue we shouldn't call it asymptomatic COVID-19, since COVID-19 refers to the disease caused by SARS-CoV-2. A more accurate term would be asymptomatic infection with SARS-CoV-2. But that takes too long to type. Okay, if they're asymptomatic, feeling fine, how do we even find them? It's a huge challenge, made even tougher when you remember that shortages of tests, very common earlier in the pandemic, less so now, sometimes force clinicians and policymakers to limit testing to those with symptoms. Only through active surveillance can we find people who have infections and are asymptomatic. Examples include testing all people admitted to the hospital for any reason, or testing groups who have had close contacts with an active case, household exposures, on cruise ships, in nursing homes, or doing tests as part of a population-based epidemiologic investigation. Want an example of broad testing to pick up both asymptomatic and symptomatic cases? Read about what Iceland did. Warning, it might give you a serious case of epidemic envy. Do all these studies give the same result? Definitely not. Results vary depending on the susceptibility of the population to developing symptoms, and how intense the exposure has been.